If you're anything like me, like learning anatomy to sports injuries, this is episode 85, and this is JuJu Watkins, March 24th, 2025. Had to get some women athletes on here, so here we go. USC, Mississippi State, March Madness last year. JuJu's trying to get to the basket. She goes down hard and grabs that knee, and that's not good if you are JuJu Watkins. So as you can see, she gets fouled here by this defender. She gets pushed towards the baseline, but she's still trying to get to the basket, and she goes down and grabs the right leg. So let's take another look at this angle here. As she plants this foot, she's getting pushed towards the sideline, but she's still going to try and push off to get to the basket. And now her right knee is behind her left. Okay. So that is a valgus collapse. And we'll take another angle of it here. This is actually a phone video, a really good video showing that right leg collapse. And she goes down and grabs the leg, obviously. So what is involved here? Well, it is her knee, of course. It was cutting plus deceleration. So as she was trying to cut from the sideline towards the goal, she was slowing down as well as pushing off of that knee, okay? And that caused a valgus collapse. And as we know, valgus is when your knees go closer together. Varus is when they go farther apart. So her right knee collapsed towards her other knee or towards the midline of your body, and that is valgus. So the ligament involvement, it was an ACL ligament tear. So the ACL checks for anterior tibial translation. Now the tibia sits underneath the femur. The femur is your thigh bone. The tibia is your shin bone. So as you can see right here, the ACL would check to make sure that the tibia does not slide too far forward at the knee joint or on the femur. And here, obviously, that happened. It slid too far forward during the collapse, causing a tear. Okay, also possible, medial collateral ligament sprain during valgus. The inside of your knee gets further apart, so the MCL could get stretched here. So think about if this side of the knee was coming towards me, this femur is going that way and this tibia is going that way. And so these condyles come apart and that could tear your MCL as well. Meniscus tear is also possible, highly correlated to ACL tears. Unhappy triad would be an ACL, MCL, and a medial meniscus tear. So what did they do? Well, on-court assessment, probably did some special tests. She was on the floor for a minute before they actually got her up and off the court. Lockman's test, anterior drawer test are two that you can use to test for an ACL tear. If you wanted to try these, if you want to pull on the tibia with the knee slightly bent, and if it goes too far forward, likely a positive test. So she was unable to bear weight, probably just ask her if she could, and obviously she's in a lot of pain, so she could not, and she had to be carried off the court. So they carried her off the court, took her to the hospital where an MRI confirmed the ACL tear, and she had an ACL reconstruction surgery. So this was last year, so her rehab timeline, she missed the entire 25-26 season because it was during March Madness, but she should be ready to go for the 2026-2027 season, and she's still with USC. So that is JuJu Watkins.